Hello, Wayne County Community College District students. I'm Dr. Crystal Morrison. We're here today to finish up on a lecture that I think we started before we left school and became quarantined due to COVID-19. That's the reason we're coming to you remotely now. I think when we left off though, with this microbiology class, we left off talking about gram-positive bacteria. And I think that you have a handout that illustrated this chart here that I've duplicated on this whiteboard. So if you could get that piece of paper out, we're going to go over gram-positives and gram-negatives. Of course, we'll do gram-positives today, and then we'll do gram-negatives another day. But for this lecture, let's focus on gram-positives. Remember, gram-positives will stain a purple color. We say purple for positives. Gram-negatives, when we get to those, it will stain a pink color. But we don't want to keep all these P's, positives and purple and pink. So we say gram-negatives stain red. So that's the way I want you to remember it. Positives for purple, and the red for gram-negatives are going to be for gram-negatives red, okay? Let's go on and talk about the gram-positives today. The gram stain is gram-positive. It will stain gram-positive. We got cocci and rods. Rods, please note, another name for them are bacilli. When it's a small b, we know we're talking about rods. When it's a large b like this, then we know we're talking about the bacteria itself. But for right now, let's know that the rods and the bacilli can be used interchangeably. First, let's go down this column here where we talk about the cocci. Remember, the morphology for cocci are round. For that category, of course, we're going to talk about Staphylococcus and Streptococcus. These are two pretty big groups. Now, as you notice, all the bacteria on this board are the ones that I've decided are pretty important to know. This doesn't include every bacteria in the world. This just includes some that you will see more clinically, and things that are typically treated with patients. So these are the ones we're concentrating on. Here, the cocci, we have Staphylococcus and Streptococcus. How do we tell the difference between these two when they're both cocci? That's an excellent question. We use an enzyme called catalase. Catalase will differentiate between Staphylococcus and Streptococcus. Catalase positive will indicate Staphylococcus. Catalase negative will indicate a Streptococcus. Also, when you look under the microscope and you see these two morphologies, these two shapes of cocci, you'll note that Staphylococcus are in clusters, like bunches of grapes, whereas Streptococcus will be more linear and like in chains. So that's another way. They're both round, that's true. But ways to differentiate them will be with this Catalase Test, or if you just want to, if you're just looking at it under the microscope and you see clusters, you see chains, or you're not sure if they're clusters or chains, that's when you can use the enzyme catalase. Now what catalase does, we're not going to get a lot into which every enzyme does, because I want you to just focus on the bacteria, really. But I do want you to know that Catalase Test is available to differentiate between these two types of cocci. Catalase is a common enzyme that's found in nearly all living organisms that are exposed to oxygen. And what it does is, it just catalyzes the decomposition of hydrogen peroxide to oxygen and water. So if I take a little bit of this Staphylococcus, mix it in with the enzyme catalase, I should see some bubbling up, some oxygen release. That's the way I will know that, oh, out of these two cocci, this is a Staphylococcus that I have. If I don't see any bubbling up or oxygen release from the bubbles when I mix in this bacteria, Streptococcus, with the catalase, then I know that it's Streptococcus. So that means that it's catalase negative. So let's go on here. Now we know the difference between, how to differentiate between Streptococcus and Staphylococcus by using a Catalase test. We know that Catalase positive will indicate a Streptococcus. Let's go on and see what else we can learn. Well, now we know we got Streptococcus. Here we have a Streptococcus aureus, a Streptococcus epidermidis, and a Streptococcus saprophyticus. How are we going to tell the difference between all of these Staphylococcus? How are we going to tell the difference between all of these Staphylococcus? Well, there's another test called coagulase. Coagulase really kind of just clots or binds the fibrinogen in plasma. So it causes a clotting. So this enzyme, if the difference in the Staphylococcus is a Staph aureus, then it will be catalase positive. If it doesn't clot and doesn't show anything going on with the plasma, then we will say it's a Staph Epidermidis or a Staph saprophyticus. This is how we tell the difference between the two species, or the differences in Staphylococcus. How do we tell the difference between Staph and Strep? We use a Catalase test. How do we tell the difference between Staph aureus and other Staphylococcus? We use a coagulase test. I will be asking those types of questions so that you will know how to tell the difference between different species and genuses, but you don't have to really know so much about the actual enzyme itself. No more than what I've mentioned today. So let's look at Staphylococcus. Staph aureus is an array of, can cause an array of infections. One thing is it kind of hangs out in the nasopharynx, so really like in the nose part of our bodies, and it's normal for it to be there, but it also can cause a lot of infections, folliculitis, barnacles and barnacles, osteomyelitis, and a famous one, of course, is pneumonia. Now, I need you to consult your text along with these lectures so that you can see the pictures and you can understand what I'm saying. And you know that you're using the McGraw-Hill textbook. So that's the one I want you to continue to use. Staph aureus is, of course, you know, it's a gram-positive cocci in clusters. The virulence factor, and I'm always looking for the virulence factor. So when you do your reading, I want you to always see what makes this bacteria, and when we get to viruses as well, what makes it harmful to humans? What makes it infectious to humans? That's the virulence factor. In this case, for Staph aureus, is protein A. Protein A is the virulence factor. So when you're studying, you'll be looking for those things and taking your notes and putting them in your notes on this chart. Or you could just make an outline. So I want you to make sure you go to Staph aureus, go to Staph Epidermidis, and go to Staph saprophyticus, and then write down things about it, because I'm not going to be able to go into a lot of detail with each of these bacteria. This is going to be a skeletal view, but I need you to fortify your notes. It's going to be up to you to fortify your notes and make it bulkier, make your notes bulkier. So protein A is the virulence factor, and what makes it virulent? It inhibits phagocytosis. Now you know that anything that prevents your white blood cells from eating up something that a pathogen, that is really going to end up making you, the human, a lot sicker. So the virulence factor protein A with Staph aureus inhibits phagocytosis. And once you do that, then the bacteria can just go wild and infect all of the cells, right? Like I said, it usually colonizes like in the nose or the nasopharynx area. It causes a lot of inflammatory diseases, skin infections, abscesses, pneumonia, especially often with an influenza type virus. You could get a pneumonia with this, endocarditis, septic arthritis, and osteomyelitis. We also know that Staph aureus is involved with MRSA, which is methicillin-resistant Staph aureus. So this bacteria, it can really fight even antibiotics, methicillins, all the cillins, penicillin, ampicillin, things like that. So you have to use another antibiotic to kill this. So I want you to fortify your notes. That's not everything about Staph aureus, but that gives you kind of a clue about it. Let me see if there was anything else that I kind of didn't mention. Another thing about Staph aureus too, you might see in your text something called scalded skin syndrome. That's pretty much where you get desquamatization of the skin. It kind of sloughs off. That's very painful and can set you up for other infections, but that is caused by Staph aureus as well. Let's go and look at these two bacteria that are with coagulase negative. So if you remember, things that are positive go with Staph. It's Catalase positive, and Staph aureus is coagulase positive. Let's go and look at this other part of Staph Epidermidis, epidermitis, that we know about. This one, Staph Epidermidis, it infects prosthetic devices. Things that, like, for example, hip implants, we get knee replacements, heart valves, and IV catheters. And they produce this adherent biofilm. And we know about biofilms. We know that this, like, the sticky stuff that's in your shower, the kind of scum that comes up in your swimming pool or pond, or the plaque that's on your teeth. Those are biofilms. And once that little sticky glycoprotein gets on something, it can wreak havoc. So Staph epidermidis, and you can see the word epidermis, you can see that is really on our skin, right? So it is a component of normal skin flora, and it can definitely, if you don't, say you're getting a blood draw and you don't use the alcohol, when you stick the needle in, you can definitely introduce Staph epidermidis into the blood system, but it's usually on our skin and doesn't cause us any problems. But when it gets inside the body, in places it shouldn't be, then it could wreak havoc. Let's look at Staph saprophyticus. Staph saprophyticus is a bacteria that's usually seen in young sexually active women, and it causes a UTI, urinary tract infection. Actually, it is second only to E. coli, which E. coli is the number one cause of urinary tract infections in women, I'm talking about. And this one, Staph saprophyticus, is second to causing staph infections, urinary tract infections in young sexually active women. It causes, and I could say adolescent females as well. So that gives us a good gist of what's going on with Staphylococcus. Let's go on and take a look at Streptococcus. Remember, Streptococcus is catalase negative. If you put a little bit of this bacteria, Streptococcus, into, and use this enzyme with this bacteria, It will not bubble up. It will not show any signs of oxidation. Let's put it that way. Now with Streptococcus, we have to look at how it hemolyzes. So we look at these 3 different ways of hemolysis with Streptococcus. Staphylococcus doesn't have really anything to do with, we're not going to be concerned with hemolysis with Staphylococcus. But Streptococcus, we will look at how it hemolyzes. So I need you to make that distinction. With Streptococcus, you have an alpha hemolysis, beta hemolysis, and a gamma hemolysis, right? Alpha hemolysis is seen with Streptococcus pneumoniae. We call that strep pneumo, or sometimes, like in the media, it's known as pneumococcus. Fortunately, we're able to have a vaccine for this kind of infection, strep pneumoniae. Why were we able to get a nice vaccine for it? Because fortunately, it has this capsule. Now, I could say fortunately for it, but it's also unfortunate too, in one way. So it's fortunate that it had that capsule because we're able to take that capsule, crunch it up, and not make it as virulent, and then reintroduce it back into our bodies as a vaccine, so we'll build antibodies to it. So if our body ever sees strep pneumoniae, or pneumococcus as it's also called, then it'll attack and prevent us from getting this bacteria infection. But that capsule also, we must remember, is there to protect the bacteria. And having a capsule on bacteria is another virulent factor. And why is that? Because it's going to protect it from phagocytosis. And anytime the bacteria is not able to be eaten or gobbled up by macrophages or the white blood cells or phagocytes, that is going to make it more virulent and able to infect more cells. So this is very important. Yes, it's good it had a capsule because we're able to take that capsule, crunch it up, chop it up, make it a lot less virulent, and reintroduce it back as a vaccine for us. But it's also, if you do get infected without having a vaccine, that capsule is going to make it hard as heck to kill the bacteria due to it being anti-phagocytic method. Please remember that it's positive for a quell lung, and that is just indicative of it having a capsule. When we see the hemolysis, which I need to explain to you, remember we had some sheep blood agar in a petri dish, and sometimes when you see the bacteria, you see some clearing around the bacteria. Well, that clearing, and please consult your text as well, that clearing in this case is a partial clearing, and it might see like a little green hue. That's how we know it's an alpha hemolysis, and that also helps us know that that is Streptococcus strep pneumo. Okay. This one, Strep viridans or viridans streptococcus, also known as Strep mutans, is also an alpha hemolysis, but this one has no capsule. And unfortunately, too, Strep viridans or Strep mutans, you could use those interchangeably. When I learned it, it was Strep viridans, but now it's Strep mutans, so they're the same thing. Has no capsule and is not as virulent. This is the kind of bacteria that sticks to our teeth and causes dental caries, also known as cavities. So this bacteria can stick to the teeth, and it's a normal mouth flora, that's true, but you have to brush to kind of keep it at bay, but it can cause caries. Here, let's go to this one. This kind of hemolysis is clear. So around these types of bacteria, and please note this is beta hemolysis. This kind of bacteria, these will show clearing around the bacteria. So there'll be like a circle. Let me try to show you what I mean. Well, I'll come back to it, but let me get through it. Group A, you have Group A, Group B, and Group D. Remember, you have Group A, Group B, and Group D with beta hemolysis, which has a clearing around the bacteria. It's not some partially green clearing or partial clearing. No, this is all clear with no hue of green for beta hemolysis. And beta hemolysis is broken up into groups. Group A, Group B, and Group D. Group A has Strep Pyogenes. Strep Pyogenes is a big deal in that it can cause a severe sore throat, severe pharyngitis. We call that strep throat. And some people, especially children, usually are the ones around 6, 7, or 8 get strep throat. Usually adults don't so much, but children for sure have a much higher propensity to getting strep throat than adults. This is the bacteria that causes that, Streptococcus Pyogenes. The important thing about this group A, beta hemolytic Strep Pyogenes, is group A, beta hemolysis, Strep Pyogenes, is that it has a sequelae, meaning if you don't get that Strep Pyogenes cleared up, you don't get that strep throat treated with antibiotic, it could go on and cause heart disease and or kidney disease. You could get an endocarditis and you could get a glomerulonephritis. That is the reason this is very important to treat. This one is very important to treat, Strep Pyogenes. I think it could go on too to cause like a scarlet fever as well. So that is very important. Group A, beta hemolytic bacteria to treat. Let's look at Group B, Strep Epidermidis. Let's see what this one is about. Strep Epidermidis, whenever you see this, just think of a newborn. Automatically. As soon as you see anything that says Group B, Strep, think, oh, newborn. Why? Because the mother's vaginal canal can be coated with this bacteria. And when the baby comes through that canal during birth, the baby can also get this coating, and it can cause this baby to have a pneumonia. It can get in the baby's lungs. It's a normal flora, but usually for the vagina, but usually the OBGYN will treat the mother with antibiotics, maybe in the first trimester and later in the third trimester during the time when they think the birth is going to occur, to mitigate the chance of the baby acquiring this group B strep, right? So whenever you think about Strep Epidermidis, or you see this, or you see it also called Group B strep, some of you, I know you know that already, think of newborn, okay? Think of a newborn. It could cause neonatal pneumonia. It could cause sepsis. I mean, it's a big deal. So the mother should be treated prior to delivery, for sure. It could also cause a meningitis in the newborn too. Group D, I don't really deal with this. I just wanted to show it to you. It's an Enterococcus. Got Enterococcus faecalis and Enterococcus falcium. Really, these are in the gut, and really Enterococcus faecalis is the bacteria that makes up most of the bacteria in our stool. I know we talk a lot about E. coli because that is in the stool as well, but Enterococcus faecalis is really the major bacteria that's in our stool. We don't really talk about this one too much. I don't really have a whole lot to say about it other than it colonizes the large intestines, and really that's about it. The same with this one. We're going down to the gamma hemolysis, which indicates no hemolysis at all. With the Peptidostreptococcus and the Enterococcus here, it's not a group D, but it's just another kind. It's not much that I say about those either, but I just wanted to introduce these so that you will at least know, if you see it in the text, alpha, beta, gamma, that it is all has to do with Streptococcus, and that these will show how the bacteria will clear the sheep blood. All right, let's look at these now. Some other parts of gram-positive, we call these branching filaments. I wanted to introduce this just to give a full round picture of the gram-positives. We don't really see a lot of actinomyces or nocardia. Nocardia maybe, but not so much actinomyces. But I wanted to introduce these branching filaments that are also gram-positive. The actinomyces is anaerobic, non-acid-fast type of bacteria. Actinomyces is in a normal oral flora. It could cause an oral facial abscess. Now, I may not see this too much, but dentists probably see these, and probably oral surgeons and things like that, they may see these. And it can drain through the sinus tracts, and it's going to form a yellow kind of sulfur kind of granules. And it should be a picture in your text on that. And it's just whatever the sinus tract is, maybe in the maxillary sinus, usually, it can cause bacteria to start draining to the outside of the face from the sinus. It's kind of gross. But remember that it's anaerobic and it's non-acid fast, but it still stays gram-positive. So it prefers not to have oxygen when I say it's anaerobic. This one though, Nocardia, is aerobic and it is acid fast. Kind of puts me in the mind of tuberculosis, but I don't want to get that confused. So Nocardia is aerobic, acid fast, and Nocardia is really found in the soil. It could cause pulmonary infections in immunocompromised people. It can cause infections with trauma and also with immunocompetent people. So usually this is seen with people whose immune system has been compromised. The immune system is low, so Nocardia can come on the scene. It's aerobic, meaning it loves oxygen. It does test acid fast. I mention that because the only other thing that we're going to learn about acid fast will be when we do Mycobacterium. And really, that's, I just wanted you to know the difference between actinomyces and Nocardia. One is anaerobic, non-acid fast, and then Nocardia is aerobic, acid fast. Now, let's go to our last category, and we should be winding it up for this portion of for the gram-positives. Okay, so let's continue on from where we are here with the rods and the bacilli. You know, rods can also be called bacilli. These two are interchangeable. So we have under gram-positive rods, there's a nice little category here of Clostridium. Please note that Clostridium is an anaerobe, where, let me compare that to down here, Bacillus, which is an aerobe. The reason I'm comparing these two, Clostridium and Bacillus, is because these two are spore formers. Now I want you to remember that they're spore formers, and I'm going to come back and talk about what spore formers do, what spores are, and the significance of being a spore former. But these two, Clostridium and Bacillus, are spore formers. Clostridium is an anaerobe, Bacillus is an aerobe, meaning it likes oxygen, prefers oxygen, Bacillus does, but Clostridium, on the other hand, is anaerobe, says, I prefer not to have oxygen, and that would be okay with me. Here's the next bacteria, Corynebacterium. So we got Clostridium, Corynebacterium, Listeria, Bacillus, and Mycobacterium. Now, I put Mycobacterium on here because it is a gram-positive, but really it needs another stain in order to really identify it. It needs an acid-fast stain. But I just put it on here because Mycobacterium causes tuberculosis, and that's really a big thing. It was on its way out, at least in our country, but HIV and AIDS happened, and Mycobacterium tuberculosis came back with a vengeance. So now you have to treat it, and it was a lot more than we did before. So anyway, I want you to know that it is a gram-positive bacterium, but it does need a different stain, an acid-fast stain to really identify. So let's look at Clostridium, which is an anaerobe and a spore former. It's a rod. So let's look at Clostridium. Clostridium, big category, like 4 things in Clostridium. I'll see if I can write them. Maybe I'll change the color of my ink here so we can look at that. Clostridium, we'll just abbreviate it as C. It's 4 categories. So Clostridium tetani, and I'll let you know that this is Clostridium, just so you know. All right, so Clostridium tetani, this, as you can see, tetani, the species of this, where the genus is Clostridium, it causes tetanus. And it produces an exotoxin that causes tetanus, and tetanus is going to block some neurotransmitters, inhibit glycine, which is a neurotransmitter. Now, sometimes how can you get this? Well, in some cases, and I remember a case where and you have a picture in your textbook showing the effects of tetanus. In layman's terms, though, we call it lockjaw because it is so powerful, this bacterium, that once it gets in your system, it clamps shut your jaw, your teeth, so you can't move your jaw. You can give an antitoxin, but it doesn't reverse what has already occurred. It just prevents the toxin from exacerbating the problem, to making it worse. There was a case in Hudson Hospital, which was years ago. The pregnant woman delivered the baby in a cab. The cab driver happened to have scissors in his glove compartment, so he delivered the baby, which was heroic within itself. Then he cut the umbilical cord with these scissors he happened to have in his glove compartment. And when we the doctors there got the history, got everything about what happened, they immediately had to give the baby and the mom, apparently, an antitoxin, and to make sure that they did not get Clostridium tetani. In some places where you don't have great medical equipment, people will use, when you use a can opener and you had a kind of round, kind of very sharp edge of the can that you open, they'll use that to cut things in the body or cut things off. And that could definitely, the bacteria is right there, rusty things, and you could get tetanus. The classic example is stepping on a rusty nail through a gym shoe. And you should definitely go and get a tetanus shot if that, or get scraped by a rusty nail. Sometimes it doesn't have to be rusty. But the booster, the shots are good, but the booster shot that you get, supposed to get every 10 years to prevent this from occurring. So it's a vaccine. Fortunately, we have that vaccine. The other Clostridium that we have in this category Clostridium perfringens. Clostridium perfringens can cause this gas gangrene, actually. These spores, remember this is a spore former. Spore former gets into the wound and that contain the dead tissue, and these spores can germinate and grow, and they can release potent toxins. So it produces a toxin, ahemolytic lecithinase, and it could cause myocronosis, myonecrosis. So it can make the muscle where the wound is, it can necrose it, make it, kill it, in other words. And we call that gas gangrene. So if you see gas gangrene or anything about a wound being infected by a Clostridium, just think of Clostridium perfringens. Okay? Clostridium Botulinum. This is, you can see the word botulism in here. So this group of this Clostridium is in the group that causes botulism. Botulism is now used, this bacteria is now used to make not just women, I was going to say women look refreshed, but men are using botulism too, and Botox. And they can shoot it into areas of your face or whatever you want to look like it's more relaxed. Like people have, they call them crow's feet. You want to get rid of those lines here. Maybe you don't want any lines in your forehead, or you don't want smile lines, wherever it is that, whatever is bothering you that you don't want. You could get these, a little bit of this injected into your skin, and it will relax the skin, and it looks nice and smooth. Actually, you look like you don't make any facial expressions at all. I don't know who wants to look like that, but it causes botulism in other ways, and that's a deadly form of food poisoning. Usually, too, we see this with people who do home canning. So home canned goods can cause this kind of food poisoning. Maybe your mom has told you, or has told you, at least my mom told me, that was shopping, always check the cans and make sure they're not dented or punched in any kind of way, because then air may have been introduced, and then this bacteria can be introduced into the food source that was canned. Home canning, there's maybe you didn't heat the food hot enough and these spores are still alive, and they can cause food poisoning. Another thing before I forget to mention about Clostridium botulinum is that these spores are oftentimes in honey. So this is a food source that you do not want to give anybody under the age of 1 year old. 1 year olds can and younger cannot handle eating honey because the spores in there are too detrimental, cause too many problems with their GI system. Their GI system just isn't mature enough to handle the spores that are in honey. So never ever sweeten a baby's milk, water, or anything, food source or anything with honey if that child is under 1. I probably just wouldn't give it to him even if he is over 1. Just wait till he becomes a lot older, and then you won't have a problem with that, because you don't want somebody with getting food poisoning with Clostridium botulinum. All right, so the last one, it's only 4 of these Clostridiums. This one you guys are very familiar with. I know this because I've lectured with this before, and everybody goes, oh yeah. This is Clostridium Difficile, or they call it, hope I spelled that right. Yeah, C. diff. C. diff. Everybody knows this one. A lot of people that have worked in nursing homes or being caregivers, they're like, if you ever smelled this from the fecal matter of a patient, you will never forget it. Well, I have never taken care of like old people, so like that. So I have not had the opportunity, thank goodness, to smell this, but everybody, like my students, tell me what C. diff is. So it causes intestinal infections, especially in hospitalized patients every year. I mean, this is a really big deal. Usually it's from people that have been treated with antibiotics, and now the antibiotics have killed all the gut biome. They call it microbiome now of the gut. And the so-called bad bacteria has now overgrown, and the person's got all this diarrhea coming out, and it's caused by C. diff. Usually hospitalized patients getting treated with antibiotics. That's the way we usually see it. Produces a cytotoxin or endotoxin, and it kills the cells in the gut, and it causes this pseudomembranous colitis. Usually, especially with people who have taken clindamycin or an ampicillin. We see that a lot with patients that have taken those two antibiotics. You don't want to treat with any more antibiotics. Sometimes you could just hydrate the person with IV. Make sure as they poop out, you're rehydrating them just as quickly. Or you can use, you don't want to use any more antibiotics. So in other words, you can let it run its course, or you can use something called like metronidazole, I think, will help with that. So these are the 4 categories of Clostridium: Clostridium tetani, Clostridium perfringens, Clostridium botulinum, and Clostridium difficile, also known as C. diff. All right, those 4 you'll have to know for this spore former, Clostridium. Let's go ahead and take a look at Corynebacterium. Corynebacterium causes diphtheria. Corynebacterium diphtheriae. All right. The symptoms, and it's a picture in your text, I think. Symptoms are, of course, fever, but there's this pseudomembranous pharyngitis. In other words, you open the mouth, you look in the back of the throat, and the tonsils and perhaps even the uvula, but anyway, in the back of the throat, it's just covered with this kind of whitish, grayish membrane. We call that a pseudomembranous pharyngitis. And you have a lot of lymphadenopathy where the cells are trying to fight this bacteria. The lab diagnosis is based on gram-positive rods with metachromatic granules. So really, I just want you to know that Corynebacterium causes diphtheria. Fortunately, though, we do have a vaccine for that. It is with the DTP, if you heard of DTP, that is for diphtheria, pertussis, and tetanus, actually. So we give that to the babies, pretty soon. So there's a whole story behind this diphtheria. If you've seen this movie, it's a cartoon. I can't think of that dog's name. Balto. So that was before, before antibiotics were really that popular. They were popular, but they weren't that widespread. Kind of like getting, well, we'll just leave it at that. All right, so let's look at the next one, Listeria. Listeria, this is seen where this is an association with consuming contaminated dairy products and like poultry, deli meats, things like that. The funny thing about it, though, in 2011, I think we had an outbreak of Listeria with cantaloupe. I don't know what that's about, but this bacteria does show that was an unusual outbreak. Let's put it that way. It is the interesting thing about Listeria is the cells have a slow tumbling motility, so they move. They're motile, with 1 to 4 flagella. They don't produce capsules or spores or anything. It's resistant to cold, heat, salt, pH extremes, and bile. In other words, with Listeria, this is why I suggest you do not drink unpasteurized milk. I know that's popular with some people, but the pasteurization of the milk is what kills the bacteria. So that's why I wouldn't just go and drink cow's milk. I don't drink cow's milk anyway, but if you squeeze it and just drink it, many people tell me, oh, that's the best milk they've ever tasted, but I would not do that. You need adequate pasteurization and thoroughly cook the food that has been contaminated with the animal feces. So that's what you need to avoid having Listeria, right? Immunocompetent adults, people who have who are strong, have a good immune system. Sometimes you may not even know you've been affected, or you just might have a mild subclinical case, meaning you don't really need to go to the doctor or anything. Immunocompromised people like fetuses and neonates, they usually will have something going on that will affect their brain. So it can affect your central nervous system and can result in the mom eating this stuff. Like it was a case where I think it was feta cheese. A pregnant woman ate that and her fetus, she ended up miscarrying. So I don't know, they traced that back to Listeria. So I'm just saying nice, like soft cheeses. I didn't mention feta, but it could have been any cheese, but I think it was feta. Soft cheeses, pregnant women should not eat soft cheeses like feta, which I did with one of my pregnancies the whole time because I just loved Greek salad. So every day I just would have that. Unbeknownst to me that I shouldn't be eating soft cheese. So I'm just sharing that with you. Bacillus, the next one, anaerobe, meaning it really likes oxygen. I want you to know that it's another spore former. What is the other spore former? Clostridium. I'm going to ask about these two spore formers. I need you to know that Clostridium is an anaerobe and not too particular about oxygen, but Bacillus is an aerobe, loves oxygen, prefers it. But these are two spore formers, so I want you to remember. Bacillus, let's see. So you know about Bacillus. Bacillus is with anthrax. We've had Bacillus, first of all, let me mention, comes from the soil, right? It inhabits soil, dust, whatever. Its endospores are a constant intruder wherever sterility or cleanliness is important. Spore formers resist any type of ordinary cleaning. In other words, detergents, disinfectants, soaps, whatever. They are very resistant to that. The way you have to kill spores, really, and the way we have to do it with our surgical equipment, is you have to use an autoclave. You gotta use steam. And for like 121 degrees Celsius for like 20 minutes or so, or half hour or so. You gotta use steam in order to kill spores. So spores are really there, and why do they make themselves into spores? That's because being a spore keeps these bacteria being resistant to the environment. Say it's unfavorable conditions for them. They don't want to vegetate and become very vulnerable, so they become this little spore, and this spore can last for centuries. You got spores from the same spores back from biblical times to today, and if they see that there's an opportunity for favorable conditions, they will sprout or become vegetative, and now you can kill them with detergents, whatever. But as long as they're spore formers, they are very tough and highly resistant to harsh conditions, okay? So Bacillus, you have two. We're going to talk about the spores of Bacillus Anthrax have been seen and used in probably bioterrorism. We had a time when they were sending these spores in letters and news and in envelopes to people that some people wanted to get rid of. They opened up the envelope. Now the spores have been airborne. You breathe that in, it gets to your lungs. That could be a big problem. Got another type of bacillus where it's called Bacillus cereus. This is a commonly seen in food that, like, I want to say rice. And when you reheat it, you may not heat it up properly, and now you could get these spores released, and they germinate and produce enterotoxins and, cause gastro problems. So we have a skin type of bacillus that will cause these black eschar type of black skin lesions or eschar vesicles on the skin. You get it from when you are like a farmer and you're shearing your sheep, taking the wool off, and you can breathe in the spores because, like I said, it came from dust and soil. So the sheep is now rolling around in the soil. These spores, once you shear the sheep, take the wool off, these spores can get airborne. That's called wool sorters disease. Now they're in your lungs. So these are ways to get infected with bacillus, right? The last one is Mycobacterium. Mycobacterium, as we say, is acid fast. In other words, it needs another type of stain, not just this gram stain. That just lets us know it's gram positive, but you need another stain, acid fast, to confirm that it is a mycobacterium. The big thing about Mycobacterium is that it causes tuberculosis. This is Mycobacterium tuberculosis, right? And we all know, or probably familiar a little bit with tuberculosis. It can cause fever, night sweats, chills, weight loss, hemoptysis, where you're coughing up blood. It's transmitted by fine respiratory droplets. Sounds familiar? Fine respiratory droplets suspended in the air. Although this type of bacteria, this bacteria can stay in the air suspended for several hours. It's very resistant, and it can survive for 8 months in a fine aerosolized particles. The larger particles are trapped in the mucus and expelled, but the smaller ones, the tinier ones, are inhaled into the bronchioles and the alveoli deep within the lungs. These are strict anaerobes, by the way. They love to be in the upper portions of the lung. They grow well on simple nutrients and media. The important thing about Mycobacterium, I want you to remember, is that it has this waxy layer to it called a mycolic acid, and that is the thing that makes it virulent. Very hard to kill this bacteria due to that darn waxy layer, mycolic acid, okay? So there are other mycobacteriums, but the only other one I think, Mycobacterium leprosy. That's a good one. That we don't call it lepra anymore, or leprosy. We now call it Hansen's disease. I guess people thought about that biblical term, and maybe it was embarrassing, I don't know, but the Mycobacterium can cause leprosy, and it loves cool temperatures and affects the skin and the superficial nerves. It's a very disfiguring disease where the nose, things that protrude, will start to become disfigured. The fingers will start to get eaten up, where you have, like, instead of like a glove type hand, you will have a mitt type hand. It will start to look like a mitten, because these parts, the top parts, the distal parts of the fingers will start to actually disintegrate. The nose can, the tip, the ears can, etc. But even if you're around people that have leprosy, not everybody gets it. It's just going to depend on your immune system. A lot of things depend on our immune system. And your immune system is really, major part of it is in your gut. This is research that's coming out now. But anyway, with Mycobacterium leprosy, it's It's very disfiguring. The reservoirs, though, in the USA are in armadillos. So if you're out west, like in Texas, California, some areas like that, Arizona, do not pick up or touch an armadillo. Just saying, you don't want to get leprosy. Fortunately, we have some treatment for that, and I think it's Dapsone, something like that, and that will help to slow the pace of this mycobacterium. So those are things I wanted to mention. There's another Mycobacterium avium intracellular, seen in HIV and AIDS patients, and oftentimes Mycobacterium is very resistant to drugs. You got to take a lot of about 3 to 4 different drugs over a period of 6 months to a year to get rid of this doggone Mycobacterium, if it's tuberculosis, especially. So that's the thing. Keep your mouths covered, and I think that will wrap it up for learning about the gram-positives. These are the things that these are the bacteria that I'm gonna want you to know about. I want you to supplement the notes because, like I said, it's only so much I can do under these circumstances, so I'm gonna rely on you to use your textbook during our office hours. You can ask me questions, and I will be going over during office hours, which you know are gonna be via Zoom for now. We will be able to hone in on what you need to know. But these are the bacteria that you need to be studying now. We'll do gram negatives next time, but for now, study this, go to your textbook, and find out what gram positives are and look them up. And I'll talk to you next time.